Welcome everyone to another episode of Resilient Women in Medicine. I have been meeting with a bunch of really cool women who have gone through lots in their personal lives and their professional lives. And many of these women have recreated their lives to make them so much better. And today I am joined by a good friend of mine, Elaine Chien, MD. Elaine and I worked together in our OBGYN practice until she had to leave due to some medical stuff, which she will tell you about, as well as dealing with both being a mom of a daughter who was having her own medical issues, as well as some infertility issues. So I can't wait to hear all about it. Welcome, Elaine.
Thanks. Hi, Bev. It's a pleasure to be here. Thank you.
Happy New Year. Hopefully the coming year is going to be better for all of us.
Yeah. Yep, I agree with that. But I think that, for our family, what we've learned is that you really can't predict what will ever happen to you. And all one can do is try to make the best of what we have and try to roll with it.
Well, and you certainly have experience with rolling with it. So now you were in basically the prime of your career, being an OBGYN. So what happened that sort of cut that short for you?
Yeah, thanks for saying that. I do feel like it was sort of the prime of my career. So the year I turned 40, and at this point I'd been about 15 years into practicing OBGYN, I learned that I had a pretty major medical issue. I developed a recurrence in carpal tunnel syndrome, which had happened the first time when I was pregnant with my daughter. Had a surgery that went away, it was fine, but then it recurred again a second time. And then when I turned 40, I also experienced a herniated disc in my neck. And these two nerve injuries basically conspired to end my career as a surgeon. And when I was told that I could no longer safely do surgery on other people, I realized that I needed to think of plan B. So that's basically what happened. I remember going through really quite a roller coaster of emotions because to be fair, I also had been feeling a bit burned out at this point. And I had been thinking, I wonder what I should be doing now. Should I continue doing this thing that I love but feel burned out doing, or should I try to make a switch? And it wasn't great that the choice was made for me to quit practicing medicine, but in a way it was kind of the universe just saying, there are other plans out there for you, Elaine. Just look at them and see what happens.
But at that point, you didn't really know like what you were going to do outside of clinical medicine. How did that all happen for you?
I knew what I didn't want to do. I did not want to continue practicing OBGYN in a way where I couldn't use my surgical skills. Went through a series of medical procedures. Declined having a surgery on my neck because I just felt like, I really didn't want to go there. And once I got myself sort of medically stabilized, it became again very apparent that going back to a surgical career wasn't in the cards. So then it was just, I guess there was a lot of soul searching about what it was I really wanted to do. And like I said, I knew I didn't want to do a non-surgical career. I knew that I still wanted to help people in some way. And I realized that I had an MD after all, and there are lots of things that MDs can do that don't involve seeing patients. So I spent about a year really just, it sounds funny, having a lot of coffee dates with people. I was very lucky to be the beneficiary of a husband who worked in the biotech industry in the Bay Area. And he had a lot of connections who were MDs, some of whom had been seeing patients in their previous lives and some of them hadn't. But all of them had their own perspective about what MDs could do outside of seeing patients. So it was quite literally about a year of coffee dates with a large variety of people, former MDs, some that were not MDs, some of them were business school types, some were basic scientists. And I learned a lot about what other options there were. And so I tried a few different options, actually. I'll cut to the chase. I actually landed in biotech, which I love. And I've been doing drug development now for 7 years, almost 8. But on my way to biotech, I learned that there were other areas of non-patient care I could do. So I worked in medical devices for a while. I also worked in healthcare IT, which was actually a great way for me to kind of break into the non-patient care side of things. My first gig was actually as a consultant / advisor to a company developing an app. And this app was for pregnant women to help manage their pregnancies. So they needed somebody with medical expertise who would actually walk the walk and been an obstetrician and could help advise on the medical content and the user friendliness of the app, if you will. And that was a great foray into the field. Anyway, I went from that to some med device work. And again, all this time still having coffee with a lot of people to learn about what was out there, and ended up landing in biotech. And I love what I do now.
And did you find yourself having to redo your resume or interview and really promote yourself? And how did that feel in terms of promoting yourself in something where maybe you didn't actually have experience?
Yeah, that's a really good question, Bev. There was a little bit, it was kind of, I would say it was a balance of promoting myself, but also being quite transparent about what skills I did not have. I certainly never wanted to represent myself as expert in anything that I hadn't done before. But what I tried to convey to people I interviewed with was a sense that I was open to learning new things, and that I didn't have an ego. I didn't mind sort of being the junior person on the team because I hadn't done what I was being asked to do before, and demonstrating that I was willing to be resourceful and not have to be spoon-fed, if you will. And that has worked for me really well. There is a little bit of promotion in terms of, at least I could talk up what I had accomplished as a physician. And to my pleasant surprise, that was highly valued by a lot of people.
And so what are you doing now?
So now I am an executive medical director at a biotech company called Mirum Pharmaceuticals. And I lead clinical trials. I actually design clinical trials, and I get them, I discuss them with regulatory authorities like the FDA, get them to approve our clinical development plans. And then it is basically my responsibility to enroll human patients in clinical trials and do it in a very safe and ethical way, but in a way that also can demonstrate that our drug can work. And so it's this beautiful, complex puzzle that I get to work with every single day. And I get to use all kinds of skills. I definitely still put on when I was a practicing physician, how did I do this kind of a hat? And that's been very, very valuable to me. I also get to put on all kinds of other hats that I've never worn before. Didn't realize how much biostatistics one would have to know in order to do this. But again, I kind of walked into my first gig doing this saying, look, guys, I don't know anything about this stuff, but I really want to learn. Point me to where you want me to learn this stuff and I'll make it happen. And so it's just been this wonderful journey, and I'm still growing. I feel like this field is something that I could do probably for the rest of my career, because it just it feeds so many parts of my heart and my brain at the same time.
Well, and isn't that where we all want to be in our lives, is
Yeah.
loving what we do and continuing
Yes.
to learn. That's awesome. I'm really happy that you've found this path, and that you can, as a physician, learn new things. And I think promoting ourselves in that way can be a real foot in the door.
So now I'm sort of entering the phase of my career where I now also have people reporting to me. So now I am seeing more sort of the expert MD in the field. And so that's been another whole other journey, I guess, of developing myself. As a practicing physician, other than collaborating with colleagues and supervising residents, I didn't have a lot of experience as a manager or a supervisor, and that's been really fun. I'm really embracing this idea of sort of servant leadership, where I have people who report to me who I don't consider to be my underlings. I consider them to be people on the journey with me, and we're kind of learning together. So that's been really good growth experience for me.
And how is the compensation in your field now compared to your clinical job?
Yeah, so now I'm at the stage of my career where I'm actually comfortably making quite a lot more than I did as an obstetrician in California. But it took time to get there. My first few gigs, certainly that wasn't the case.
Of course.
Yeah.
All right, well, let's switch gears and tell us about also what you were going through during that whole phase of you trying to transition out of your clinical career. You were dealing with your daughter, Emma. So give us a little bit of a peek into what that was like.
Yeah, that was another very painful but very huge growth experience as well. So my daughter is 16. And when she was born, we learned that she had congenital hip dysplasia. At 8 weeks of life, we had to bring her into surgery because they needed to basically try to fix her hip while she was a baby. And I will never forget bringing her, to the hospital that day, 8-week-old baby, my first time mother. And I was going through my first bout of carpal tunnel at the time. So my own hand was like not functional. I think I was in a cast or a splint or something. And just really for the first time understanding, oh my gosh, this is how it feels to hand your child to someone that you don't know that well, who's going to cut your child open and try to fix their problem. Emma has had 15 trips to the operating room now for her hip. I'll just never forget the day that she took her first steps. The absolute joy. It was nothing less than a miracle for us that she could walk. Yeah, and actually now, I'll fast forward to the good part. My daughter now is 16 and she's a nationally ranked youth championship rock climber. So she's gone to nationals now twice and done quite well for herself. And she's demonstrated to me what resilience can look like.
So being a physician and having someone, either yourself or your family member, going through medical procedures and stuff, did you find that helped you or hindered you in terms of how you dealt with that and also your own patient interactions?
I would say it kind of was a little bit of both. It was, some of my medical training certainly came in handy. Like I found that I could identify sort of complications, if you will, early when Emma had them. So that was good. But on the other hand, I wasn't an orthopedic surgeon either. So it's like that little bit of knowledge gave me maybe more anxiety than I would have had I been a bit more blissfully unaware of what could be happening. It gave me definitely empathy in just huge volumes. I don't think I ever considered myself to be not that empathetic, but I became way more empathetic being on the other side of things. And I guess, I would count not only Emma's medical issues, but my own, with the neck issues and I've had some shoulder surgeries. I've had actually, seems like quite a lot of surgery in the last 10 years myself. So just knowing how it feels to be a little bit helpless and at the mercy of a healthcare provider gave me a lot of empathy.
Yeah. I can relate to that. When just being pregnant and being an obstetrician makes a huge difference in how you deal with your OB patients.
Doesn't it though? I mean, it's like before you have your own child, you kind of think you know what you're doing, but then it's a whole different dimension after you have your own.
And then in addition to all of that, of course, you were trying to get pregnant with your second child.
Yes.
How in the world did you deal with all of that and have all those balls in the air all at once?
Well, yeah, that was interesting. I think there was some compartmentalization that I had to do, especially during the infertility, because, as we discussed, I was an obstetrician with a pretty busy practice. And so I went through several years of secondary infertility where I kept, going through IVF and failing IVF, and yet having to kind of put on a smiling face and see pregnant patients in the office every day and deliver these babies every day. And I remember thinking to myself, whatever happens here, don't get resentful of these patients. They're living their lives. They have their own issues. I have my issues, and we're going to keep it sort of professional, and so I think that helped me a bit. I definitely remember getting to a point where we were trying to have our second, and it just felt like, this is not going to happen. I mean, we've now failed IVF multiple times, and it's been years of this. I'm not getting any younger, and it's okay. And it was interesting because as soon as I came to peace with the fact that we weren't going to have another child, we got pregnant spontaneously. And now that child's 11 years old. So there was almost this like beauty in letting it go. And when I let it go, it happened.
And that's not a unique story either. I see that all the time. Yeah. Well, so, you have your resilience in so many ways in your life, Elaine, and I'm so happy that you and your kids and everybody are doing so well. For other women physicians who might be struggling out there, either in their lives or in their careers, is there anything that you would like to impart in your wisdom?
One of the breakthroughs was there were dark times. And I remember trying to just talk myself out of feeling these dark feelings and talking myself out of just being sad, frankly. I would say things to myself like, oh, come on, it can't be that bad. And I got to a point, after getting therapy, actually, that I realized, why did I need to not feel things? It was better for me to feel what I felt and to work through that instead of denying that it was there. So I think advice number one is feel what you're going to feel and actually let yourself go through it. And I think a close second is, if you do need to talk to a therapist or a coach, do it, because I've done that a few times in my life and it has helped me a lot. There's nothing like, I think, an unbiased person who's objective and can take you a bit outside of your own self, outside of your own mind, and just help you see alternatives. So I think not only have I benefited from professional help, but I also have benefited from having the world's most amazing husband, who has been a rock through all of this, you know. So having support of any sort, you know, it doesn't have to be a husband, it could be your friends, your siblings, your parents, whoever it is, super important to get through it. As you go through a lot of different transitions and try on different hats that maybe you haven't worn before, just being kind to yourself. You know, the first thing you try is not always going to work out. I mean, I tried on a few different post-clinical gigs that didn't work out. And the thing is, I didn't regard them as failures. I regarded them as learning experiences too. I learned what doesn't work. And so when you kind of let yourself have more of a forgiving growth mindset and just stay open to options, whatever you love is going to be out there for you. And I really believe that that's the case. It's not always instantaneous though. You know, certainly was not instantaneous for me, but it's out there.
Yeah. All those things you just said are just so important in terms of figuring out a life that you love. And the self-compassion piece is huge. So, yeah.
I think we women rarely give ourselves that grace. It's incredible the things I would say to myself that I would never have said to a friend or a sister. But I told myself, like, oh, come on, suck it up. I mean, why? Why did I do that to myself? And when I realized how toxic that was, it was a big breakthrough for me.
Well, thank you so much for telling your story today. It's been wonderful to catch up with you, actually.
Yeah, no, same. And I was just going to say, I guess I have to say I miss working with you. I miss working with my colleagues, but yeah, there's life after medical practice. It's
Absolutely.
out there.
You found a wonderful path forward, and it sounds like you're on your way to being a huge success. You are already.
Oh, thank you. Thanks.